ahead and tell me a little bit about what this drug is again.
So we're talking about two drugs here. One of them's chloroquine, which has been used for a long time to treat and prevent malaria, which is a parasitic disease you can catch from mosquitoes in the tropics. The other drug is hydroxychloroquine, which is a daughter of that drug. Although originally developed for malaria, it was found to be useful in some diseases like lupus and these other autoimmune conditions.
Now, could this drug possibly be beneficial in treating the coronavirus?
So the idea that it is that it's found in a test tube to inhibit the growth and the replication of the virus. So that was intriguing, and because it slowed it down in a test tube, it was thought that some patients it might be useful, and that's where people started trying it.
So is there any signs that it might be? Have there been any?
Yeah, so that's one of the things that we deal with in medicine and science is signs don't count for us. You need a study to prove that people do better because the placebo effect is huge, as well as the huge variability we see in this disease. Many people have no symptoms. Many people have mild symptoms. So it's hard to know just when people report that it works. And that's why really getting the trials up and going is going to be the ultimate answer.
Do you know if there are trials that are running right now to see if this would be beneficial?
Oh, absolutely. There are many trials for hydroxychloroquine and some with chloroquine as well, looking for it in the use of COVID going on across the country. But a lot of the use has been outside trials where people are just giving it a shot.
Now, how long does it normally take to come up with to come out of these trials?
So the FDA has made special requirements and has sped things along. The nice thing is that with these drugs, they've been used and they're approved for other indications, like I said, malaria or lupus. So you don't have to do the early phases to know about the safety and tolerability of them. We just need the studies done where you have, half your group with it, half without perhaps, and you look at how they differ over many hundreds or thousands of patients. That takes months, but not forever. It's a much abbreviated process compared to some of the new drugs that are being developed.
Now, I've seen that this could cause side effects, and some people are saying the side effects are worse than getting the actual virus. Is there any indication of that, or is that a person-by-person basis?
Yeah, it's kind of on a person-by-person basis. Again, many people take these drugs for months or years to control their conditions, and they do fine with it. The dosing that people are trying is often different in these COVID-19 patients. And yes, you can have serious life-threatening side effects from these medications.
Now, would this be more of a prevention thing or a treatment if this is to be a drug that we use?
Yeah. So again, people are initially looking at it as a treatment drug and trying it out on many of these patients. It is possible that it could be used for prevention, and studies will have to show that. But the problem is for prevention, you might have to take this drug every day or a couple times a day for months, many months or a year. So your chance of side effects goes up. So that's going to be a lot harder to prove. And because preventative drugs are given to people who are well, we don't tolerate as many side effects in well people as we would in someone who's already sick.
Gotcha. Anything I didn't ask that you think is important to mention about this drug?
There have been reports of people reading the name of chloroquine or hydroxychloroquine and going out and getting it, whether it's for industrial use or agricultural use and taking it, and those are not safe things to do. Many people have been harmed already by that. Again, if it's found to be useful, we'll work with the pharmaceutical suppliers and those to increase human grade, but you can really get hurt using stuff that's not intended for humans. No, I think everyone, rather than sitting around waiting for these drugs to be approved, either for prevention or treatment, we absolutely know the best prevention right now is to maintain your social distancing, 6 feet away from other people, very good hand washing, covering your coughs and sneezes, and then washing or sanitizing your hands afterwards. That's what we know that works. That's what we have right now. We need to do it.